About is diverticular disease. This is high yield information. You have to know this code. Why? Because it's so common, and patients are always worried when they develop these complications from these diseases. So you as a physician, you want to recognize this when they come into the emergency room. So what is diverticular disease? We're always going to talk about definition, right? I kind of have like a little outline here on the board we're going to follow, but I want you to split your brain into two, because students always get confused about it. Diverticulosis, diverticulitis, especially the first time you hear it. And do never let anybody confuse it, because they're two different things. They have the kind of the same underlying pathophysiology, but you got to know the difference, and extremely important. I have to stress this. So diverticular disease can be split into two. Diverticulosis on my right, diverticulitis on my left. So what is diverticular disease? Diverticular disease is outpouching of the mucosa and the submucosal wall of the colon. See these little pockets? They're not normal, but because of a lot of intraluminal pressure around this area. This is your descending colon, and this is the sigmoid. This is most commonly happen around the sigmoid because it's the most narrow part of the colon, and it gets too much pressure. Something like this. You got a lot of poop stuck in here, right? And people are constipated, especially people that have a bowel movement once every 3 weeks. Ooh, I don't know what's up with that. That's really bad. You should be having bowel movements every day. They stack a lot of poop in here, and it has nowhere to go, and it's stretching the wall, and eventually what? It forms a pocket, and you get this nice little pocket. They call them diverticuli. Okay? Fancy name for a little out-pocketing of the colon. So, they're cyclic protrusions. And you can only see this if you actually do a colonoscopy, so they don't know what they have. They probably have it for years. So that is diverticular. So now, what is the risk factor for developing this? In America, we don't eat a lot of good food, right? Everybody's eating hamburgers. Nobody wants to eat diet. Nobody wants to eat fibers. Nobody wants to eat fruits. So everything has to be, fatty food. So people, risk factors for developing this is a low fiber diet. So all my friends, families, right, brothers, sisters, if you're not eating a lot of fibers in your diet, you're setting yourself for constipation, because fiber is a lot of cellulose, right? You need cellulose. Cellulose, that stuff that your body can't digest, but it gives your poop this nice, I know it's not like the funniest thing, but this is important. It gives you a nice smooth transition through your GI tract, so when peristalsis happens, you can squeeze all this poop out. But the problem is, if people are eating very, very low fiber diet, they get constipated a lot. And the problem is, a lot of fatty diet. The double cheeseburger, like less vegetables, less fruits, bananas, oranges, stuff high in fibers. People don't eat it, but they eat more fatty food. What happened? Their poop is always getting stuck in here, right? And then they form this out-pocketing. So that's diverticular. Now, what is diverticulosis? We've talked about the risk factors. However, this usually happens also in people greater than 40 years old. So you're not going to see a 10-year-old kid coming in, right? After 40 years of eating, double cheeseburger with no fibers in your diet, you're setting yourself for this. And also constipation, not good. All right? So let's move on. Definition. Diverticulosis. This is going to be a painless, let's write it on the board. Painless, bloody stool. Can I emphasize this word, painless? Let me explain it to you in words. So, Bob is going to be a 45-year-old male. He's going to go to the bathroom one day. He's going to sit down like everybody else, and he's going to strain. There's no abdominal pain. His belly doesn't hurt, and all of a sudden, he looks into the into the bowl, into the toilet bowl, and bam, right? He looks into the toilet bowl, and lo and behold, he sees blood. He's scared. Pool of blood. This is different from him wiping. See, when patients say, oh, when I wipe, I see blood, well, they might have an anal fissure. That's different. This is a lot of blood coming out from this diverticuli. But the problem is, they rupture a little blood vessels in the process, and bam, blood trickles out into the bathroom. And it's painless bleeding from their rectum. And they're scared. I mean, you've been having bowel movements forever, and now you see blood coming out. That will scare you. But you have to realize this is painless. Now, that's the only symptoms they might complain of. But what are the symptoms they're actually going to be complaining of before the blood comes through? Assuming the guy hasn't been really watching his bowel movements, right? The guy's not checking, he just uses the bathroom, cleans up, leaves. Let's talk about the symptoms, right? The only thing on the history they're gonna give you is a painless bloody stool. They're gonna say, I have a bowel movement and I poop and blood comes out and it's red. I mean pure red. When I mean that color, yes. But when you ask them what symptoms they're having, they're gonna be like, yeah, I've been feeling tired, right? Fatigue, right? Short of breath, lethargic, right? You tell them, do they feel lightheaded? They say, yeah. Lightheadedness and shortness of breath with exertion. Now let's explain why they're fatigued, why they're short of breath, why they feel lightheaded. Because they're bleeding. These patients are anemic. These are all the signs of anemia. Right? Because they're bleeding. Bright red blood per rectum. When you bleed, you lose blood. When you lose blood, what happens? You're anemic. When you're anemic, when you try to move around, you extract all the oxygen from your red blood cells. There's not enough to go around because you already lost a lot of blood. You start to get short of breath, right? Your heart gets strained a little because it's not getting enough oxygen. You get dehydrated, so every time they get up, they feel lightheaded and they're fatigued. So that's going to be their symptoms. Now, how do we diagnose it? The only thing you can order is a CBC. You get a CBC, you may have some leukocytosis. Why? Because there's a little bit of blood coming out here, right? They're a little under stress. The white count is going to go up. But if you might find it, you might not find it. But what you're looking for in a CBC is they might be anemic. Look at your hematocrit. Right? If it's less than 10, this guy's been bleeding a lot, right? It's coming out of their butt. That's not bad. Because they're anemic, they're having all the symptoms. So that's what exactly we are looking for on the CBC. We look for the hemoglobin, we look for the hematocrit count, and if that's low, that's telling us this guy is anemic. Now, as an emergency physician, what do you want to rule out? Right? We already know the symptoms. We already know exactly what the definition is. Painless, bloody stool, diverticulosis. The labs, we ordered a CBC before, right? You want to order an abdominal x-ray. What's the point of ordering an abdominal x-ray? This little pocket, they can perf. And if they perf, that is really bad, right? Air starts to leak out because there's a lot of gas inside your belly, right? That's why everybody farts. If the fart doesn't get out and there's a hole in here, now there's gas in the belly, right? And now under the diaphragm, when you look on x-ray, right? You see here air under the diaphragm. And air is black. So you want to make sure they haven't perfed yet and the person is straining, because that's bad. That can cause peritonitis and go into septic shock. You don't want to miss that. But that's the only reason why we order an x-ray. We don't really, it's not going to diagnose the disease. The most important test we got to order is a CAT scan. You order a CT scan, you'll be able to see this out-pocketing. Like, yep, I know you're in the butt. We just got you. All right? So you order a CAT scan. We're going to talk about treatment in a minute about diverticulosis. Since they're just bleeding, eventually the bleeding will stop. I promise you, it will stop. Yeah, it will stop on its own because the body has a method of, blood clotting. If you haven't watched Blood Clotting Cascade, go back and watch one of our lectures on Blood Clotting Cascade. The bleeding will stop. Now, you're going to tell them, Mr. Jones, I know you're scared because you're bleeding from your butt. But as bad as you think it is, it's not that bad, okay? What's important right now is to change your lifestyle. Eat a lot of fibers. You want to put these guys on a lot of fiber diets, okay? Tell them to take metamucil, something like has a lot of fibers in it. Tell them to eat fruits, oranges, stuffed vegetables, so that they don't continue to strain and eventually one day they might perf. That's not good. So you want to give them a lot of fibers. You can give them some fluids. Another thing you can also do is also do fiber supplement. That's the only thing you can do for this. Now, if the blood doesn't stop, that's a problem, right? So you want to watch them in the hospital before they leave to make sure the blood stops. Because when you do a rectal exam and you smear it on a stool guaiac, it's going to be positive. So what you want to do, if the bleeding doesn't stop, what do? You want to make sure you have blood ready, right? So we've diagnosed them. Just kind of highlights if the bleeding doesn't stop. Non-stop bleeding. You want to give them a lot of IV fluids, right? Normal saline, something in that realm. Or we can also give them blood if they need it. You got to cross and match and the cross and screen, right? Cross and screen and cross and match and eventually give them blood. All right? But aside from that, there's not much we do. On the flip side of things, we've got diverticulitis. Now the rules of the game is going to change because now the diverticular is getting inflamed. What causes this? The cause is a ficculus. A ficculus is basically a hard poop. That's how easy I make these things. It's a hard poop. This hard poop is going to get stuck in here. Okay? And now the blood is congested, has nowhere to go. But the thing you have to know that's different in diverticulitis, they're going to be in a lot of pain. Because what will happen, they're going to get ischemia because this poop is obstructing the entire pouch. And now the blood flow is not able to go. So it's painful. Right? It's caused by the ficculate obstruction. So on history, they're going to be complaining of left lower quadrant abdominal pain because it's inflammation, right? They get an inflammation around this area. The bacteria in the poop is also causing some inflammation. They get some ischemia around the area. Ischemia causes pain, right? It's just like chest pain in your chest. Aside from the ischemia, they'll get fevers, nausea, vomiting. That's going to be their symptoms. Left lower quadrant pain, fever, painless, bloody, non-bloody stool. That's the good thing. That's what you want to know. So when you look at their symptoms, left lower quadrant abdominal pain, fever, nausea, and vomiting, constipation. So in diverticulitis, there's no blood. No bloody stool. Because the ficculate is obstructing, so all those blood vessels that actually penetrate, right? The obstruction distends, it blocks the blood flow. All of a sudden, it causes inflammation. This guy's get a lot of pain. So you want to know that. The two different things, don't ever mix them together. Diverticulosis, painless, bright red blood per rectum. Diverticulitis, left lower quadrant abdominal pain. Right, you're going to be like, it hurts in here so badly. It's probably the first time they're having it. Now that diverticuli is inflamed. It's hurting. They get a fever. Why? Because this bacteria. All those E. coli in your poop, right? All those enterobacteriaceae in your poop, they're causing inflammation. What happens? Neutrophils is going to come in there and they're going to try to engulf them up because it's inflammation, right? Inflammation is going to drive, neutrophilic infiltration, interleukin 8, all that good stuff, right? So you get bacterial infiltration, and every time you get interleukin-1 release, you get a fever. It's an infection, right? You get nausea, vomiting. So they're also constipated. So watch out for that, constipation. Because I could tell he's one of these guys that you're told to take fibers and he went home and never did. And now eventually they stretch this thing, and now a poop got stuck in there. They got an obstruction, they start developing fever, nausea, vomiting, bacterial infection, right? And they're still constipated. So this is serious. This is more serious than diverticulosis. So on labs, when we order a CBC, right? When I palpate on physical exam, when I push it, oh, that hurts. You don't want to do that because that's going to hurt, but I have to, because I have to check to make sure you're really in pain. So, diagnosis. What do you think is going to diagnose this? We're going to use to diagnose this disease? A CT scan, right? We order a CT, we can get a CBC, that will show us what? Leukocytosis. Why? Because the fever, the bacteria, what's going to happen? Neutrophils are going to come in. They're going to, because of the inflammation. Inflammation also causes leukocytosis, neutrophilic leukocytosis with a shift, right? We don't have to worry about HNH, which is the hematocrit and hemoglobin. Why? Because they're not anemic. The problem is it's an obstruction. It's a lot of pain. Now, the only thing we can do in this kind of problem is we got to treat it, right? We have to treat this problem because we are worried about perforation. On CT scan, you see inflammation around the wall of the diverticular. That's telling you we've got an issue. Now, let's treat this patient. How do we treat? The first thing I'll do is this. If the bowel is inflamed, right? If a kid is crying, you're not going to go and hit him again, right? Oh, you don't want to do that. That's bad, right? If someone is hurting, you want to calm them down. So the first thing is what? Bowel rest. NPO. They're not eating anything by mouth, because the moment they eat something by mouth and it goes all the way down, that's a problem. What will happen? The bowel will start to contract, and dude, they can perf. So you don't want to do that. Bowel rest. You want to give them antibiotics. We usually give them metronidazole. Okay? This is going to kill all the enteric bacteria, all the anaerobes in there. It's going to kill it off so that we stop that infection, right? Remember, they have a fever, so you have to give them antibiotics for that. What else you want to do? I told you they were constipated. We put a nasogastric tube placement. So we put a tube, it goes through your nose, it goes into your esophagus, right? It goes all into your abdomen, into your stomach, and we suck out all the food out. Because number one, we want to relax. We don't want inflammation of that diverticuli, right? Diverticulitis. So when we suck out all the food, it's less problems for the bowel, and also good for it because it gets its rest, all right? Because you don't want that thing working when it's in a lot of pain, okay? So we already give them metronidazole. We also can give them some cephalosporin. That's another thing you want to do. What don't you want to do in this patient? Let me tell you exactly what you don't want to do. The last thing you want to do is consult GI, which you have to anyway, and tell them to take a scope with a little camera and try to go into their rectum to try to take a peek. You do not want to do that. You don't want to do a barium enema, right? And barium enema is basically squeezing barium into their butt. You don't want to do that, and you don't want to do a flexible sigmoidoscopy, which is basically what we normally do if you want to look at diverticuli. Because I forgot to talk about this, but I'll wrap it up in the summary. But you do not avoid, you want to avoid sticking anything up their butt, because when you do that, you're going to perf. And when the perf, the bacteria that's already in the bowel wall is now going to spill into the peritoneal cavity. And when it spills into the peritoneal cavity, that's not the place it's supposed to be. It's going to cause more inflammation. Now you get peritonitis. This bacteria is going to jump into your blood. There's a lot of endotoxins. You're going to get a lot of systemic vasodilatation. You're going to sepsis, and people can die. So You don't want to do that, okay? That's a serious, serious problem. You're going to get sued for that. So you want to avoid flexible sigmoidoscopy. You want to avoid barium enema in the initial stages of diverticulitis. That is extremely important because perforation is an extremely big risk. Now, if this thing does perf though, right? Because it could. When it perfs, now they're going to have a rigid abdomen. It becomes a surgical procedure because now the abdomen is so hard, involuntary guarding because of the inflammation of peritonitis. So what do? If this perfs, a perforated diverticuli, please call surgery. They're going to the operating room. And when they go into the operating room, what surgery are they going to get? It's called the Hartmann's procedure. So what do they do in surgery? Let me show you real quick. Since this is the area that's inflamed, they're going to cut it off. I've seen this. Not fun. They cut it off and they form a stump. They staple this and they take this other part of your GI tract and they made it a diverticulostomy. They're going to take this part and bring it out to the skin. And now your poop is going to be sticking out. Right? Your bowel is going to be sutured to the wall of your abdomen so that when you want to have a bowel movement, you got a diverticulostomy bag, and this weird bag around your skin, and that's where all your poop is going to be going into. That's called Hartmann's procedure. What do they want to do? Eventually, after 6 weeks, and there's less inflammation around this area, they take this piece, and they reanastomose it back together. And then, so for the next 6 weeks, once they do the Hartmann's procedure, you ain't going to the bathroom that route through the butt. You're going to be going through your abdomen, okay? So that's one serious complication. That's why you don't want to perf this guy. Now, to summarize it, we say we have diverticular disease, we have diverticulosis, and we have diverticulitis. In diverticulosis, painless, no pain, but no left lower quadrant pain, but they have bright red blood per rectum. Okay, it's this guy that's now eating a lot of fibers over 40 years old. You want to remember that. We treat it, right? We figure it on the CAT scan, and also after you see it on the CAT scan, you can tell the GI guy to do a scope, do a flexible sigmoidoscopy, kind of look into the wall of their bowel and see, oh, see, you got a couple of diverticuli in there, so you got to be careful. But when this thing gets inflamed, it becomes diverticulitis. And this is serious. You get fever, left lower quadrant pain, they're nausea and vomiting. You stick a tube down their nose, you suck all the food out, right? You also give them metronidazole or antibiotics to cover the bacteria. You can give them some third generation cephalosporin. And also, you want to rest the bowel, okay? God forbid this perfs. If it perfs, they're going to surgery to get the Hartmann's procedure, okay? That is the end of diverticular disease. And that's the end of our lecture.
Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, be able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.